Okay, so we're going to go ahead and I'll do the intro now. Alrighty, so I see people logging on. Awesome. So hello everyone and welcome to the fourth live webinar presentation of the 2022 Hidalgo County Employee Winter Wellness Fair. I will be starting off this webinar with a sound check. If you can hear me clearly, please click the raised hand icon. Again, if you can hear me clearly, please go ahead and click that raised hand icon. Awesome. Thank you very much. So before we get started, I would like to let everyone know that attendees do not have a microphone feature on this webinar. If you have any questions, please utilize the chat box feature or the Q&A, and we will answer questions at the end of the webinar. Okay, our speaker for this fourth presentation is Guillermo Duran, Jr., MD. Dr. Duran currently serves as a clinical research coordinator at the DHR Health Institute for Research and Development. Dr. Duran received his undergraduate degree in biology and has a minor in chemistry from the University of Houston. During his undergrad, he participated in academia research at the Center of Nuclear Receptors and Cell Signaling at the University of Houston. He also has completed clinical research at the Texas Children's Hospital in Houston. His passion for human health led him to obtain his MD at Universidad Autónoma de Guadalajara, Mexico. Dr. Duran is a well-rounded health professional exhibiting medical knowledge and clinical research. Aside from his work, his hobbies include spending time with his wife and daughter, traveling, and learning ways blockchain can enhance our daily lives. Alrighty, thank you, Dr. Duran. Go ahead and take it away.
Thank you very much for that introduction. Welcome, everyone. Today's topic is fatty liver awareness. A lot of folks that I get a chance to speak with don't understand what fatty liver is, but they understand cirrhosis. Cirrhosis, a lot of attention has been attributed to drinking excessive amounts of alcohol for a prolonged period of time. But is that really the only case that we develop this cirrhosis or this disease in the liver? Well, no, there's a number of other reasons, other stressors that can lead to a buildup of inflammation in the liver that can lead to scarring. The most prevalent one is fatty liver. And a lot of folks that have fatty liver don't know that they have it, and much less here in the Rio Grande Valley area. For most areas in the world, nobody likes to go to the doctor unless they feel something that prompts them to actually go to a doctor's visit. So it is a silent disease. It doesn't present with any symptoms. And today we're going to actually go around and talk a little bit about fatty liver. We'll go into some sort of a depth. We'll introduce the fiber scan and also talk a little bit about what we are doing here at Doctors Hospital Renaissance Research Institute. So I do have a presentation here that I would like to share with you. So I'm going to go ahead and share my screen. I want everybody to tell me if they can see that. Okay, I think so. So we'll go to the first image. So non-alcoholic fatty liver, NAFLD. So I'll walk you through. A patient can go in, they may feel something where the liver's at. So usually in the right side of the chest wall, they'll feel like a little disturbing pain, not too concerning, but they just want to go ahead and get themselves checked out. So of course they get blood work. In that blood work, the physician, the provider will look into liver functioning enzymes. So these are the aspartate transaminase and the alanine transaminase. These are the ASTs and ALTs, and any basic metabolic panel or complete metabolic panel will be able to pick up on these. Now, for the most part, if that AST level is within range, it gets disclosed and nothing is really much done about it. In other cases, if the patient is complaining of some bothersome pain there and continues to have bothersome pain, the provider will order an ultrasound. And so it's a special, it's an imaging procedure that can pick up on the morphology of the tissues. They're the liver, the gallbladder, the pancreas, the kidneys, all within that abdominal region. And that's when it gets picked up, fatty liver. That's when they get to see, oh, hey, you have fatty liver. Then the conversation becomes diet and exercise, lose weight. Now, the reason being is because there's not an established treatment for fatty liver, much less for fatty liver with inflammation. It's something that we're going to talk a little bit about in this lecture. And so the only thing available is diet and exercise. So we tell these patients lose weight, eat healthy, exercise, and I always tell patients it's a balance between eating healthy and exercising. It's very important to exercise because yes, diet alone can help you lose weight, but you also have to take care of one important organ, which is the muscles. And the muscles, maintain our skeleton, it's our joints. So we start to not use them frequently, we start to lose that muscle mass, and we start to gain more joint instability. And that's further we age. We tend to have more back problems, we tend to have more joint issues, etc. So it's a balance between both. So weight loss is the go-to. That's the first line treatment. A little bit more aggressive would be to take something to help patients lose weight. And so a lot of people know about Ozempic, semaglutide. There's actually an injectable form and there's also a pill form. Actually, about a year ago, I think the FDA approved semaglutide in the pill form to be used as a weight loss medication. And there are others, like Manjaro. I know I spoke to a few patients that are actually already self-injecting Manjaro. And it helps with, more than anything, their diabetes. So the hemoglobin A1C is a biological marker that's tested every 3 months. That's the one that a lot of patients say is like, oh, I have to get my 3-month appointment to check for my diabetes. That's the hemoglobin A1C. And it's a good reference biological marker to assess how that diabetes is being managed. The lesser we have it, generally speaking, it's best to have it less than 6.4%. Less than 6% is where we really want patients to be, and especially if they're diabetic. But that's usually the step-by-step approach on what we're really focusing on. But we'll continue on. So what is fatty liver? It's a non-alcoholic fatty liver disease. It's a spectrum of disease. It starts with the buildup of fat in the liver, which is steatosis. I'll start throwing some medical terminology, but I'll define it. So that's the accumulation, that's the buildup of fat within the liver cell. And because there's buildup of fat in the liver cell doesn't like that. It'll start to be inflamed. Okay, the liver will start to inflame, and then it'll lead to a buildup of scarring in the tissue. Now imagine a cell that's role is to carry on a function. Okay, but if you pack a lot of things into that cell, well, it starts to disrupt its regular function. And so the cell will remove itself from the group. Okay, and when it does that, it leaves a void. So now you have one less cell within the group. Okay, and because of that, there's chemical signals that the liver will start to, the liver cells will start to pass on, and there's this inflammatory response. And this inflammatory response comes from another group of cells coming into the area, noticing, hey, there's one cell that removed itself, and then because of that, it'll start to flag other cells to come in and do the patchwork. Okay, and that patchwork is the buildup of scar. So if I were to give you the formula of how one can develop scar tissue in the liver, it would be the buildup of fat in the liver, which is a stressor, leading to an increased inflammation, leading to a buildup of scar. And it's a gradual process. Okay, it takes time. It's not something acute that happens overnight or within a few days or within a few weeks. This is an ongoing insult due to the buildup of fat in the liver that influences that increased inflammation, leading to the increase in scarring. So here you have a pictorial. This is the healthy looking liver. It looks very nice. This is the kind of color, very smooth, that we would generally see if there was a surgeon to open up, do a gallbladder surgery removal. That's the color of the liver, generally speaking. Then it starts to look more fatty if that patient has that buildup of fat in the liver. This is how it would look. Very yellowish, starts to kind of bleb a little bit in certain areas, but that's that buildup of fat. Then it starts to turn brown. And that's when there's that buildup of scar tissue. Once it looks already firm at this stage, cirrhosis, the liver would be firm. And it's noticeable on physical exam when the physician does a physical exam and tests the liver, it'll feel rubbery compared to here where it feels very soft. Okay. Here we have another pictorial more in depth, and I have here reversible and irreversible. Now the only organs, excuse me, that do not regenerate. Everything else regenerates, but the only organs and the organ tissues that do not regenerate are brain matter, so the brain, and also the heart. Okay. Um, Everything else regenerates. Now, of course, there's a little bit of a time difference between all the different organ tissues, but nonetheless, they do regenerate. So let's say we have a patient that has fatty liver. We talk to them and we encourage them to lose weight. When they do, and they reach that recommended goal, which is 10%, then we would expect the liver to be reduced in fat. You know? So if that were the case and that patient also had inflammation, well, now there's nothing to elicit or to create that buildup of scar. And whatever viable tissue, whatever healthy tissue is there will regenerate over the areas of damage. So that's why I have their reversible. So it is a reversible condition. You know, that's why education is such a prime tool to bring more awareness and help patients understand, you know, what to do, give them the tools, the guidance, encourage them, motivate them to keep them from progressing further into a very serious state of the disease. Okay. In cases of cirrhosis, it's manageable. However, in some cases, we would need to introduce a conversation about a transplant of the liver. And even then, transplant even carry their own complications further further out. On the bottom side of the pictorial, you see the hepatocyte. This is healthy. This is a liver cell. Okay, that's the nucleus. That's like this the think of it like the brain center of each cell. There's like certain genetic material that is kept very compiled, and it carries information, which renders instruction, renders function for the cell. And then these little yellow droplets are the small droplets of fat. This is a healthy representation on a slide. So if I were to take a tissue of healthy liver and look it under a microscope, this is more or less what I would see. Further down, if you look at fatty liver buildup, you see these large droplets of fat. That's what's going on. Now, how does that get there? Well, we eat carbohydrates, we eat protein, we eat fats. On the western side of the world, we tend to eat a lot more carbohydrates than we do proteins than we do fats. And vegetables is very negligible, if not minor. Okay. So what happens to that excess carbohydrates? Where does it go to? Well, everything goes into our stomach, digestive system, gets broken down into finer units. Then it gets absorbed in the intestine, where it goes into the bloodstream. Well, the bloodstream will carry it first into the liver. And from the liver, it'll start processing, and it has more accessibility to the carbohydrates. It'll start creating fats, different kinds of fat proteins called apolipoproteins. It'll create cholesterol. So it has a lot of function in creating fats, cholesterol, processes all these fats. So you can imagine it having a very large accessibility and processing in all of its nutrients. Well, that excess carbohydrates, for the majority of it, if it's not used by the body, yes, it gets stored in the form of glycogen in the liver. The muscle also does a little bit of storing of glycogen, which is a specialized sugar unit. It's just a fancy word of saying that's the way that tissue stores sugar. Glycogen is sugar within the body being stored either in the liver or in the muscle. But whatever the body doesn't use it is not going to get rid of if it means that it's going to render energy. So the liver is going to start shunting that sugar into fat metabolism. Okay, so you have more accessibility to that fat, thus causing that increased stress. As we can see here in the pictorial, going from NAFLD to NASH, well, it just increases that buildup of fat in the liver, causing there to be stress within the liver cell. Now the cell can't carry on its given role. And then we have a buildup of inflammation. And because of that inflammatory response, we have a buildup of scarring. And that's these collagen fibers that you see here. And if the disease continues, furthering into cirrhosis, well, I have here irreversible. It's really hard to kind of replace, areas where there's severe scarring. Okay, and then we have a very big problem. Okay, so going back to the formula, okay, we have a buildup of fat in the liver that leads to a buildup of inflammation in the liver, which leads to a buildup of scarring in the liver. Now I'm going to introduce these two words, fibrosis and cirrhosis. Cirrhosis, severe scarring. It's not reversible. Fibrosis is scarring, however, it's reversible. Okay? And that's the distinction between these two. So how do you get to cirrhosis? Well, first you have to go through fibrosis. And what's the response? Like, why does scarring accumulate? Was because of the buildup of inflammation, and that's non-alcoholic steatohepatitis, which means not alcoholic related. Steato means fat, hepatitis means inflammation of the liver. So here you can see, and this is an actual real life slide cut, okay, of a normal liver. This is how it would look once it's stained. In a fatty liver, this is what we see. These are the fat droplets, large fat droplets that we see being accumulated in the liver cell. Okay, and one step further, we have the inflammatory response. So the immune system starts to elicit that inflammatory response, and then there's buildup of scarring in between the liver cells. As you can see here, this is very unhealthy, very sickly. Okay, so it's that inflammatory response, NASH, that will further propel fibrosis to cirrhosis. Okay, so how do we screen for it? So I talked about a patient that goes to a doctor's office complaining about, liver pain. Okay, we'll say that. And they get checked. Okay, but when you go to the doctor's office, of course, there's a lot of this clinical context. They talk about, okay, what other medical conditions may that person have? For the most part, there's a long prevalence of diabetes type 2, insulin resistance, impaired fasting glucose, elevated triglycerides, elevated LDLs. These are the bad cholesterols. Okay, a good way to remember LDL is lousy for bad, and that's the low density lipoprotein. We also have decreased high density lipoprotein. These are the good cholesterols that we should get in our body, and we get these normally through the fish oils. When you eat a lot of fish, they have a lot of HDLs. A lot of folks, especially when they have high triglycerides, high cholesterol, they get prescribed something called the Vascepa, and it's a higher grade form of fish oil. Really good. But yeah, overweight or obese, high blood pressure, and elevated liver functioning tests. Okay. So they do blood work, they see the elevated liver enzymes, and then they start to question, hey, something's going on. And especially if any of these hold true for that one patient, it just increases the risk for fatty liver and NASH, further adding into and supporting the diagnosis. Okay. There's other tests that can be done, an MRI, an imaging. We mentioned an ultrasound. I don't have it listed there, but we mentioned an ultrasound. That's very less costly. It's more accessible. It's actually something that a lot of health insurances would be able to authorize. MRI is a little bit more specialized, the form of exam imaging. Usually the trend is you do from least expensive to most expensive, trying to rule out diseases along the way or rule them in. But the ultrasound would be very good to see at the very least. The MRI would be a little bit more specific. Of course, there's also some concerns. Costly, it's loud, limitations, and a small space. So if you're claustrophobic, that can become an issue. The gold standard, though, is biopsy. Biopsy is the gold standard, so that's when an interventional radiologist goes in with a needle, okay, and will extract about 20 millimeters uh, worth of tissue, and it will be two to three strings, more or less. And that gets sent out to pathology where it gets processed into slides. And that's something that we saw up here. So once they get processed into slides, we put it under a microscope, and this is what we see. And the pathologist will be able to score it and give us exactly what the root cause is, if we see any scarring, what stage is it at, do we see any buildup of fat, etc. Okay, it is invasive. There always is a risk of infection because it is invasive procedure. Any invasive procedure, there's always that risk of infection, and it can be painful. Okay, so how do we really guide the patient? How do we really detect and more or less see where they stand as far as the grade of fat in the liver and as far as the buildup of scarring in the liver? The FibroScan. Okay, it's a really good point of care imaging test screening tool that we use to assess whether there is fat in the liver, and more importantly, if the liver is stiff, suggesting a stage of scarring. Okay, and that's what this technology helps us determine. With sound waves, we are able to see if the signal is being attenuated, if the amplitude decreases, that means that there is uh, more steatosis or more fat in the liver. That means that this blue number will be high. We have a report further down. I'll show you exactly what I'm talking about. And then it also tells us stiffness. So if there is something stiff, that means sound will go through it faster rather than if the tissue is not stiff, it would go much slower. Okay, so that's where it comes down to. A hard liver will lead to a high kPa value, and that's the unit that it renders, kilopascals, versus a soft liver, a low kPa value. So what we want is we want low numbers. That's what we like. We like no numbers. It's a non-invasive way at point of care. Imagine having to go to a routine doctor's office every year to assess where do you stand in terms of fatty liver, how far along are you? You know, and having to get a liver biopsy on a yearly basis, well, it won't be cost efficient for the patient. There'll be a lot of pain, a lot of suffering in that manner. That's not ideal. So we're actually trying to push further other methods that are at least just as confident as a biopsy to figure out exactly where that patient's liver stands. And those are non-invasive ways. So the more non-invasive and the more confident these non-invasive procedures will result, we can start to face further down. I like to take a moment to really just talk about the FibroScan and that we do them here at our clinic. We're not located here anymore, so disregard this. We're actually at 5321. I can put that down, South McCall Road. Okay, we're located in Edinburgh, Texas. So I'll let everybody kind of take a snapshot picture of that. Please share this information with your loved ones, colleagues, clients. We do offer free FibroScans. We work very closely with the physicians here, the specialists in hepatology and gastroenterology. We work very closely with pharmaceutical companies to help establish other medications that can treat fatty liver with inflammation and scarring buildup. Okay, so I'll just take them another 10 seconds to allow everybody to write this information down, take a picture. Okay, all right, moving along. So how is it done? We have the patient laying down, as you see here. The operator places a probe right next to the right chest wall at more or less at the area at the level of the liver. and it sends a sound wave. When we press this little button, it sends a sound wave. And like I mentioned, the amplitude, once it starts to go down or decrease, that means that there is something grasping onto the amplitude of that sound wave, which in this case is indicating fat, right? And how fast that signal goes from one point to another within the liver, the faster it goes, the more stiff the liver is, thus suggesting that thus suggesting that there's scarring in that liver. Okay, so we want low numbers. We use an ultrasound gel, so it doesn't hurt. There is maybe a slight discomfort because of the little pounding or uh, of that probe. This little black tip of this probe, it moves, thus causing the vibration. There might be a little bit of discomfort, but for the most part, there isn't. It's just generally like it feels like somebody tapping on the skin. We take 10 consecutive measurements over the same location, and the operator has to make sure that it's good. In essence, is it accurate? Are the readings reliable? These are the questions that the operator will assess. And we use quality metrics. This interquartile range, there's another image over here where I'm circling. We make sure that there's homogeneous pattern. That means that there's the pattern of the same. In this case, the tissue, we expect that wavy pattern. And everything has to align, everything has to look green at the top so as to take, generally speaking, a very good measurement. You can see the results here of this patient, 345 for the CAP and 10.1 for the E. So the 345 tells us that this patient has a severe grade of steatosis or fat buildup in the liver. Okay, well that's one part. What about the scarring? There is liver stiffness. This number here suggested that this patient has an advanced stage of scarring of F3. Okay, and there's a lot of data where we use and we extrapolate and we assess that, okay, well, if the patient's CAP falls within this range, it's steatosis grade 1, steatosis grade 2, or steatosis grade 3, right? And then the same goes for the liver stiffness. We have data that allows us to understand the ranges between different kinds of liver and different stages of liver. Okay. And then all fiber scans are interpreted by one of our providers, either in gastroenterology or hepatology. We have a sub-investigator that works very closely with our hepatologist and soon with our gastroenterologist, who also reads these on a routine basis. Okay, so I'm going to take a moment to see if anybody has any questions. I know we're at 3:30.
Okay, so yes, let me see. Alrighty. Thank you so much, Dr. Duran, for that presentation. It was really insightful and there was a lot of really good information. So yeah, we will now go ahead and open it up for a Q&A from our audience. I don't know if there's any here. I do have a couple of questions though. I'm sure you covered it, throughout the presentation, but does, fatty liver disease, it is a disease that can eventually be reversed. Am I correct in saying that?
Yes, if it's caught on earlier in time.
Okay,
It's
yes.
yes, very much so. I mean, think of it like this. If let's say when we fall and when we were kids, when we would play around and we fall and kind of hit our skin or we tear our skin and there's a little bit of bleeding and then it scabs over, right? Well, that's a
Hmm.
little bit of fibrotic tissue, right? And if we don't do anything to it, if we don't touch it, leave it alone, the body will take care of it, and then there will be the new skin that grows,
Hmm.
replacing that scarring tissue, right? But let's say in a different scenario that I were picking at it, I start like really diving in and just cutting away on that scab and not allowing the skin to fully heal. Well, eventually what's going to happen is there's going to be scar tissue forming. It's going to be very rigid, very hard, firm compared to the
Hmm.
skin. So I bring that into context because in the cases of fatty liver, if the damage continues, if that influence continues with the inflammation, then there will always be that growing scarring in that area of damage,
Right.
and never allowing the viable tissue around that's healthy to grow over that area of damage. So if it's caught on early, definitely
Hmm.
is reversible. But as you go down this progressive disease, you know, it's questionable. How
Hmm.
much of a reverse are we really talking? Are we talking about 90%? Are we talking about 80%, 75%, 50%, 30%? So
Right.
it's on a case by case scenario. But if it's caught on early, for sure.
Hmm. Yeah, and I know you just mentioned case by case scenario. We did have somebody ask if you have been told that you have fatty liver, and you follow a diet, I'm assuming a nutritional diet and exercise. How long does it take to no longer have a fatty liver? Somebody asked, and I'm sure that that's a person by person basis, but I guess generally.
Yeah, so there's really good substantial. There was a literature that looked about, okay, so how much weight do I need to lose to really notice some improvement? And the number is 6 to 7% of your total weight loss. So if a person weighs 200 pounds, if you do the math, 7% loss, that's generally speaking what the patient would do. So, I mean, an easier number to remember, something greater than 7, 10%. But if the person weighs 200 pounds, if they reach that 20-pound loss,
Mm-hmm.
um, generally speaking, we should already see a much more improved liver and thus less or reduced inflammation,
Hmm.
and thus allowing the liver tissue to start healing and regenerating over the areas of damage. And it gets followed through. In
Right.
cases with patients with fatty liver and inflammation, we always encourage them to continue with their routine visits, follow-up visits, and so we can capture them through FibroScan as that
Hmm.
number starts to go down. And once it starts to reach, and I'll pull it up here. Let me see if I can. Once this orange number starts to reach 5.0 and below, you can say that the patient gets discharged. And so now they would just follow up with their primary care physician, and then every now and then, if there is a growing concern, they can get another fiber scan just to see exactly where they stand.
Okay.
But the goal would be for this number to reach 5 and below, or below
Okay.
5. You
Awesome.
know.
Thank you. A follow-up question from that same attendee. Does drinking lots of liquids help?
So liquids, preferably water.
Okay.
Water is the great way for our body to remove the toxins. Okay,
Mhm.
so definitely, I mean, our bodies are 70% water. So the more water you can introduce to your body, the best. You know,
Yes.
not keeping in mind that there's like heart conditions or any other conditions that would retain water, and of course those cases are a little bit different. But water is generally good. You really want to avoid soda pops because
Hmm.
they have a high fructose content.
Hmm.
Okay, Diet Cokes, I would not drink Diet Cokes. I mean, if you really want to lavish and because you really like Coke, I, I like drinking Coke every now and then myself. I choose Coke Zero just to kind of suppress the urge a little bit. But generally speaking, drinking water, unsweet iced tea, and believe it or not, there's some literature that says that drinking coffee is beneficial in cases of
Hmm.
fatty liver, and also vitamin E. And there's a high source of vitamin E in almonds. So if you like to eat almonds, by all means, or like to, prepare your drinks like coffee drinks with almond milk, by all
Hmm.
means do so. Um, but definitely drinking plenty of water, at least 2 liters on a daily basis, and that just helps, uh, with maintaining that body's ability to remove the toxins and keep fluids moving forward. In short answer, the body never likes to keep fluids stagnant.
Hmm.
We always have to be cycling through fluids, moving fluids forward. And that's where we can actually become a little bit better off.
Awesome. Somebody asked, do you recommend taking the medication that you mentioned about raising your HDL first, or simply trying diet and exercise first?
Um, I always take on the conservative approach, and you always want to give your body a chance. Because for some people, diet and exercise works. But let's say for others, maybe diet and exercise didn't work, but they have to at least have tried it to actually know that it didn't work.
Mhm.
And it just depends on the goals. If there's a patient that really tries everything, diet and exercise, and for the longest time they can't lose a weight, they need help, then yeah, I mean, in that case, and they also have maybe type 2 diabetes, and so maybe in that case it would be generally a good idea to, you know, maybe consider taking on an additional medication to help them with their weight loss.
Mhm.
Uh, Excuse me, usually the first go-to medication is Ozempic. In those cases, I have also type 2 diabetes, and it helps them with improving their hemoglobin A1C.
Mhm.
The next step would be taking on like Manjaro to help them lose weight. There's also over-the-counter um, supplements and medications that can help with weight loss. I think one that comes to mind is by the brand name Ali. That's an
Oh.
orlistat. So the way that it works, it doesn't allow for the absorption of fat into the bloodstream. But one of the cases, side effects is that these patients will have diarrhea. You know, um, what else? And there's other weight loss supplements, but I would be very wary about taking on supplements because a lot of these have sympathomimetics and they affect the sympathetic system.
Mhm.
Yeah, it can actually lead to pretty much exacerbating the sympathetic system and leading to other conditions or other problems.
Okay.
And because supplements aren't, um, for lack of a better way, they're not. There's no quality
Mhm.
assurance that one batch is exactly the same active ingredient percentage, weight, and everything compared to
Mhm.
the other batch. So it's
Right.
kind of like a question mark, and that's why they're not FDA regulated. There's no studies done to supplement.
Right.
But
Okay.
yeah,
Awesome. And then one last question. Do you need a referral from a physician for this fibroscan test?
no. So we open it to the public. Like I was I don't think I introduced, but one of the aspects that we do here, one of the important roles that we do here at the clinic is we work with pharmaceutical companies. We do coordinate clinical research trials. So part of the conversation is to have this fiber scan. You don't need a referral. You can come in. We'll schedule you in, or you can call um, this number. I'll leave it up again for anybody.
So they can just call the number and
They
set
can
make an
call the
appointment?
number. Exactly. This is my direct office line, and also include my cell phone number. It's my work cell. Okay. I'm gonna go ahead and put this. But no, you don't need a referral. Okay. We don't even ask for your health insurance. We delete this. We normally just have this fiber scan. We'll talk to you. We'll let you know exactly what we see. We'll share some information about what things that the patient can do at home, lifestyle modifications. And if there is something concerning and they're interested about one of our research trials, we'll engage in that conversation as well.
Mhm.
Um, but no, we do not need a referral.
Okay, awesome. Well, great. Thank you very much, Dr. Duran. Thank you, everyone, for your participation. Thank you, Dr. Duran, for your time with us today. Greatly appreciate it.
Thank you, everyone.
Awesome.
Have a
So
wonderful day.
thank you. Yeah, so this concludes our fourth webinar of the 2022 Hidalgo County Employee Winter Wellness Fair. Be sure to check out the rest of our online platform, or be sure to join us tomorrow in person as well from 8:30 to 12 here at the Precinct 2 Indoor Sports Complex. If you have any questions, message us through our chat feature or email us at hidalgocounty.wellness@co.hidalgo.tx.us. And we will see you next time. Thank you very much. Bye-bye.